Hello, my name is Tom Vetter, and I would like to extend a very warm welcome to all of you to this aligned session with the IARS, the AUA, and SOCCA, specifically the Anesthesia and Analgesia sponsored journal Symposium. I have no financial relationships with commercial interests to disclose, and my presentation does not include discussion of off-label or investigational use. The rationale for the current session is that the editors-in-chief of 3 major anesthesia journals will discuss important perils, and pitfalls of publishing research in anesthesia, perioperative medicine, critical care, and pain medicine. An additional vital faculty-oriented perspective will be provided by a very experienced and well-respected academic anesthesiologist. The 4 learner objectives for this session are: 1, to recognize and to adhere to the specific requirements for legitimate manuscript authorship. 2, to understand the mechanisms of the manuscript peer review process. 3, to define and to avoid data fabrication and misconduct in publishing research articles. And 4th, to manage the pressure to publish for academic promotion. For this symposium, we have assembled 4 outstanding panel members. Evan Kharasch will lead off with a discussion of authorship, what counts, who cares. Hugh Hemmings will follow on with a discussion on peer review, strengths, weaknesses, opportunities, and threats. Jean-Francois Pittet will then discuss show me the data, fabrication and misconduct. And then Cynthia Wong will discuss clinical anesthesiology faculty, pressure to publish for promotion. We will then conclude with a moderated discussion and Q&A session. With that, I turn it over to you, Evan. Thank you, everyone.
Hi, I'm Evan Kharasch, Editor-in-Chief of Anesthesiology and Professor of Anesthesia at Duke University School of Medicine. I'm pleased to be part of this Editors Symposium today and to speak to you about a topic that is of importance to all of us, and that is authorship. What counts for authorship? Who counts as an author? And who cares about all this? To begin with, I have no disclosures. Let me start with the concept of authorship inflation. The number of authors on articles has been steadily increasing over the course of decades. This was an exercise I did that looked at 50 years of authorship in 7 major anesthesia journals. And what you can see in red is that the number of authors per article has gone up steadily, and it's even going up more exponentially over the course of the past decade. The gray bars show the number of articles that have more than 9 authors per article. And what you can see is that those numbers are going up exponentially as well. To put numbers on this specifically, in 1965, a median of 2 authors per article were found. And in 2021, that number is a median of 6 authors per article. If we look at the number of multi-authored papers, there were none in 1965, and there were a median of 65 multi-authored papers per anesthesia journal in 2020, and this is consistent across all journals. So let me give you 2 case studies. The first was a case report of ventilator sharing in which a single ventilator was used to ventilate 2 pairs of COVID-19 patients for 1 hour each. 4 patients, if you will, and there were 20 authors on the case report. Another example of a research report, single center observational study. There were 37 authors on this study. And the editor, in a review process, noted that the number of authors on the manuscript appeared extensive and excessive. And the author wrote back and said, look, I had clinical fellows who collected blood samples at night and on the weekend, and I can't pay them extra, so I need to compensate them, and therefore I made them authors. These are some examples of authorship inflation and likely inappropriate authorship. Looking at the general medical literature more broadly, this was a study that looked at the first 50 original articles published each decade in JAMA and the New England Journal of Medicine and the British Medical Journal. And again, regardless of the type of article, what you see is that the number of authors has gone up year over year and decade over decade. They also did an analysis, and they found that increasing research complexity is really not the explanation for the growth in authorship. Rather, the growth in authorship simply appeared to be inflationary. Another study looked at this question. Are the number of authors going up because of research complexity, or are they going up because of competitive factors? When we talk about complexity, we mean the technical sophistication of research processes, the associated specialization in research, team science, if you will. Looking at it from a competitive standpoint, we're talking about pressures from grants, patents, publications, things that inform on, impact on hiring, promotion, tenure, and indirectly affect social factors, reputation, if you will, and the allocation of scarce resources, that is, grants. And what they found is that the growth in authorship is primarily driven by research competition, not by research complexity. And that the demand for recognition really incentivizes weaker criteria for authorship. It's diluting the meaning of authors as we have authorship inflation. Ethical authorship is really challenging scholarly publication today. Well, first of all, why does authorship matter? There are a number of cognizant organizations which have opined on this. For example, the International Committee of Medical Journal Editors and the World Association of Medical Editors. And there's two fundamental principles. One is that authorship confers credit, and it has important academic, social, and financial implications. The other is that authorship implies responsibility and accountability for published work. And most importantly, credit and accountability are inseparable. You can't have credit without being held accountable. If we look at a message from the Council of Publication Ethics, or the Committee on Publication Ethics, they did a survey among their members in 2019 and asked them what were the issues of importance in publication ethics. Well, 42% of those members said they had problems assessing the contribution of authorship and the claims to authorship, or just general authorship issues. They also, 49% said that they were troubled by the lack of education in publication ethics among authors and reviewers. Again, authorship is a vexing problem. So who defines what an author is? Who defines what is responsible authorship? There are a number of cognizant organizations that may inform upon this. The Committee on Publication Ethics, the Council on Science Editors, the Committee on Medical Journal Editors, the World Association of Medical Editors, perhaps also funders and sponsors. Institutions may have guidelines and regulations, and journals too have rules and regulations around their criteria for authorship. And there is no one universal definition of authorship among all of scholarly publishing. But most organizations agree that there are minimum requirements. One is substantial intellectual contribution to the work, and that is both substantial and intellectual. The other is accountability for the work that was done and the publication that ensued. There are a number of principles that we can all agree on. First of all, it's important that authors know, understand, and adhere to the authorship criteria within their respective disciplines, understanding that disciplines may vary. Physics, biomedical publishing have different requirements, for example. For the institution in which the author works, because many institutions do have authorship criteria, and the journal to which they're submitting. And different journals may have different criteria for being an author. It's important to recognize that authorship is the responsibility of the authors. It's not the journal. And this is a principle articulated by the Committee on Medical Journal Editors. It's also not the role of journal editors to determine who qualifies or does not qualify for authorship, or to arbitrate any authorship disputes or conflicts. So again, There's no single consensus definition. Criteria differ across disciplines. They may evolve over time, and they do differ between journals. And that credit, responsibility, and accountability are all essential, and they are inseparable. It's also recognized that there are unacceptable types of authorship: gift, guest, and ghost authorship. Gift authorship, sometimes called honorary or courtesy authorship, is authorship that's offered from a sense of obligation or tribute or respect or dependence or dependency on an individual who's not contributed to the work in return for anticipated benefit. Best example is a department chair who's automatically put on a publication or a manuscript just because they're the department chair. This is the most prevalent form of gift or honorary authorship. Guest authorship is also known as celebrity or prestige authorship, in which you make somebody an author based on the belief that the expert standing or reputation of the guest author will increase the likelihood that it's going to be accepted and published and gain credibility, and will accumulate status for those authors. And then lastly, ghost authorship is a failure to identify somebody who did merit authorship. And this may range from an author for hire or a major contributor who's not named as an author. Including the wrong people and not including the right people are all unacceptable forms of authorship. Studies have shown that a quarter to a third of published articles have one or more honorary or unacceptable authors, and that honorary authorship is positively associated with the impact factor of the journal. Everybody wants to be an author on a high impact journal article, but again, that's not ethical. Authorship issues are different than research misconduct. Official statutory definitions of research misconduct include fabrication, falsification, and plagiarism. Authorship issues fall into the category of what's called detrimental research practices or questionable research practices. And there are quite a few questionable or detrimental research practices, but authorship is in that category of detrimental or questionable research practices. It's not lying about the content of the work, it's really lying about who did the work. Now, in the sense that you're still lying about the work, many people, and this is evolving, now believe that unacceptable authorship is really also fraud or research misconduct. In fact, this is an opinion issued by the Institute of Medicine and the National Academies of Science, Engineering, and Medicine. And in their statement and monograph, saying that researchers who knowingly use questionable research practices, such as unacceptable authorship, with the intent to deceive, are committing research misconduct or fraud. Now, authorship inflation is problematic, and the inclusion of distant guest authors is considered unethical, and it's rampant. And it's now considered that these authorship practices are to be considered a type of research fraud. It's not just that it's problematic and uncomfortable, it's research fraud. Now, authorship abuse is not a victimless crime. You might ask, come on, really? Who really cares about this? Well, it's important because the entire research and publication process relies on trust. And if scientists or clinicians are prepared to lie about who is involved with a research project or a paper, why should we expect them to be any more honest about their findings? This is an important consideration. Well, we also know that many people struggle over this concept and over this issue. How authorship is determined or how credit is apportioned is subjective. It can be open to abuse, and often it's determined more by laboratory politics or seniority than by actual effort or contribution. This is a challenge. unethical or inappropriate authorship may be dismissed as, well, it's just normal misbehavior, or, yeah, okay, it's just a marginal issue. It's done commonly. It's really not that important. It really doesn't affect people. But hopefully you see that it does. It's also important to understand that authorship misbehavior is learned behavior. Trainees learn it from their supervisors and from the hidden curriculum, if you will, of unethical practices about assigning authorship. And frankly, these people who learn it will transmit it in turn to their trainees. So my message is, mentors have a duty to teach responsible authorship, and trainees have a duty to learn responsible authorship. So putting this together, authors, institutions, and journals all have a role in ethical authorship. Authors have to understand the definitions of authorship and the cultures in which they work, to understand that authorship is intellectual. It's not transactional. Authorship is not given in regard for drawing a blood sample. It's an intellectual and a substantial intellectual contribution. Credit and responsibility and accountability are all inseparable. And gift, guest, and ghost authorship are considered unacceptable, if not fraudulent, forms of authorship. Institutions have a responsibility. They need to decrease the pressures on appointments and promotions. Making everybody a faculty member, regardless of what they do, creates incredible pressures on them to publish, and in turn, pressures on authorship. Institutions would be well served to have authorship guidelines and to really have meaningful programs in the responsible conduct of research. And journals, too, have an obligation and a responsibility. They should publish very clear criteria for authorship and forms of acceptable and unacceptable authorship. They should have good non-author mechanisms for recognizing important contributions that don't rise to the level of authorship. And in the peer review process, they should pay close attention to authorship and consider it in the assessment and evaluation of manuscripts, and consider that fraudulent authorship is misconduct. So hopefully you've learned a little bit more about what counts in authorship, who counts as authors, and why we should all care about this. Thank you for listening.
Good afternoon, and thank you to the organizers for this opportunity to present in the Anesthesia and Analgesia sponsored journal symposium. I was asked to discuss peer review, strengths, weaknesses, opportunities, and threats. I'm Hugh Hemmings, editor-in-chief of the British Journal of Anesthesia, and I'll be representing that journal. I'm also a professor and chair of anesthesiology and professor of pharmacology at Weill Cornell Medicine in New York. My disclosures include consulting fees from Elsevier for clinical key research funding from the U.S. National Institutes of Health and Instrumentation Laboratory. And as mentioned, I am editor-in-chief of the British Journal of Anesthesia and have some biases toward that journal accordingly. So let's start by discussing what is peer review. So many journals and funding agencies depend on peer review to decide either which articles to publish or which studies to fund. And it really depends on the expertise of peer experts in the specific fields of the paper or the grant application to provide critical evaluation based on their experience and expertise, and to assess the scholarly merit of the manuscript or the research grant. According to the U.S. Office of Research Integrity, the most respected research findings are those that have been through peer review. And most funding decisions and publishing decisions in science are based on peer review currently. It has an important role in academic advancement, as well, as we'll hear in the last talk of this session, where promotion is often based on the success in achieving peer-reviewed publications and funding. In short, research and researchers are judged primarily by their peers. So peers are as I mentioned, experts who have standing based on their education, training, their success in getting grants and publishing in the relevant area, and their general recognition in the field as a credible evaluator of work in that area. So let's go through the SWOT analysis of peer review. So let's start with some strengths. It encourages high standards, and without peer review, editors wouldn't be able to really select the best papers in specific fields. So peer review allows the editors to select the highest priority works and to publish them based on the opinions of experts in specific areas. Peer review also maintains high standards that prevents unwarranted claims from being published in articles. The reviewers encourage novel and meaningful research by filtering out the lower quality work and flawed research studies. And occasionally, as we'll hear about in the next talk, peer review can identify ethical and scientific misconduct issues that are important to screen out early as possible. In addition, peer review, and this may be one of the most important aspects for the author, provides valuable feedback so authors can improve their manuscripts or their grants. So often reviewer comments are instrumental in helping authors revise their papers and improve their papers, and that, I think, is the primary goal of the process. But peer review is not without weaknesses, as we all know. Some of those are here. So it's a slow process, partly because it depends on a number of steps, any one of which can be delayed for various reasons: personal, institutional, mechanical. So there can be long delays, and I think that's the most frustrating part for authors. That being said, journals, especially the editors, are keen to keep the process as short as possible. But we depend on the reviewers to accept and return their accept the invitation and return their reviews as soon as they can. And then it's up to the editor to make a decision as quickly as they can. And then finally, if there are revisions required, it's important for the authors to get those back in a timely manner. Additional delays not related to peer review in the publication process include the production process, which would be another discussion. Another weakness, and a big one, is that peer review depends on the voluntary work by the reviewers and often the editors. So reviewers aren't compensated. Now, this is an area of controversy and occasionally comes up that they should be, but mostly reviewers are uncompensated and do reviews out of their professional commitment to the two publications, two grants, to make sure that the best work gets published or funded. But this places high demands on reviewers, especially leaders in the field who often get invited to review many papers, and that obviously puts a strain on them professionally, as they often have other work to do, including writing their own papers and doing their own research. So for the smaller areas of research where there are fewer investigators, there's a huge demand often on reviewers. So the journals depend on the goodwill of volunteers, essentially, to provide expert peer review. There is question whether the recognition that reviewers get for doing reviews is really worth it. So the recognition is limited, and this can lead to reluctance to review. It's depending on your institution, reviewing may or may not be held as an important academic endeavor. And I think for many, it does fall lower. It's not a high priority compared to other endeavors. There are also potentials for bias and conflict, both by editors and reviewers. We ask that reviewers and of course editors disclose any potential conflicts of interest, but those can enter into the process in ways that are often difficult to for the editors to detect. So that's a potential weakness for peer review. Confidentiality is another issue. So some reviewers wish to remain anonymous, but it may not always be possible to preserve their anonymity, especially in small fields. The reviews and the manuscripts should remain confidential, or same for grants. These should not be shared beyond the reviewer, but that sometimes happens as well, and that can be problematic. One sort of pretty common challenge for editors is to maintain a civil discourse in the conduct of reviews. So reviews should be professional, but sometimes reviewers do, I think, cross a line, and it's up to the editors to moderate that process. But often reviewers, authors are hurt by some of the comments made, and no one likes to have their work criticized. So it is a very potentially fraught area where anonymous reviewers are making potentially damning comments about someone else's work. So this is a delicate area that requires constant work by the editors to keep it civil. Of course, with any work, there's variability in quality. Some reviewers are better than others, and the better ones tend to get asked more, which puts even more of a strain on them. Whether the quality is due to inexperience or poor training is another issue. I think most people don't get solid training in how to conduct peer review, although many journals do provide workshops for potential reviewers, and this can help, I think. But mostly the training for peer review is by having your own papers reviewed and sort of engaging in the dialogue between the author and the editor of the journal. Finally, there have been some questions about how effective it is, because peer review doesn't always detect all mistakes or flaws in a study, or all misconduct for that matter. That's a constant question. So we do depend on reviewers for a lot, and no one's perfect here. Another concern is that the peer review process may protect the status quo by preventing more radical ideas from being accepted into the literature. But this is a place where editors can step in sometimes. So what are some opportunities to improve peer review? Well, there are different types of peer review, and a number of proposals have been made to change, and different journals actually now are experimenting with different types of peer review. One, and I'll run through a couple of those. So one is a double-blind review where the authors remain unknown, as well as the reviewers. So this can help reduce some of the bias that may go toward specific authors or against specific authors. The most common mechanism, though, is single-blind review, which is what I think most of the journals involved in this panel use, which is that the peer reviewers know the authors, so that the authors and their institutions are not blinded, but the authors do not know the reviewers unless they choose to disclose their identity, which many do. So this is the most common system, and it as I've alluded to in the double-blind model, knowing who the authors are and where they're from may introduce some bias, either conscious or unconscious. A process that more journals are using these days is open review, where both the reviewers and the authors know each other's identity. Some journals even publish the reviews associated with the manuscripts that they accept. And this mechanism is also used by preprint servers, where the preprints are posted and comments are made, and the identities of the commenters and of the authors obviously are known. So there is an open discourse there, and the concept of open review is supported by a number of large funding agencies, although it hasn't taken hold in the US strongly yet. Transparent review is another related type of review where the contents of the reviews are made available, but the reviewers remain anonymous. And a number of journals do publish the anonymous comments of the reviewers so that readers can see sort of what the reviewers thought before before the paper was accepted. Interactive review is related, where reviewers and authors can correspond essentially publicly about their papers. And finally, transferable reviews is a sort of a newer system where if your paper is rejected by one journal, the reviews can be shared with another journal. Typically, that's in the same family of journals. So a publisher can exchange or share the reviews with another journal if the authors and the reviewers agree. So we've recently introduced this possibility for BJ in a new journal, BJ Open, which is an open access journal. So if your paper is reviewed and rejected by BJ and you wish, we can share the comments with BJ Open, and they can decide whether they will further consider the paper for their journal. And finally, it's been proposed that we eliminate reviewer 3, who is a typically more disagreeable reviewer than reviewers 1 and 2. So what are some of the threats to peer review? Well, there are a number of websites and blogs that publish comments on papers. Some of those are shown here: PubPeer, PubMed Commons, Retraction Watch, that comment on papers that are mostly outside of the journal purview. Some of these can be quite harsh. Some of them, though, are effective in identifying potential research misconduct, which is common in PubPeer. But these are often harmful and not always valid criticisms. And it does either imply that the peer review was not effective and is potentially a threat. I mentioned before the confidentiality of reviewers' comments. Sometimes this confidentiality is breached, and the authors can plagiarize the reviewers' comments, and there's concern there about copyright issues, and this is an area that hasn't really been fully clarified. Some of the biggest threats are predatory journals, where there's really no legitimate peer review, and we all get many emails a day to publish in journals that we've probably never heard of. Some of those are predatory, meaning that they are really motivated by the profit of collecting the publication charge from the authors, and will do anything to get those papers, including bypassing peer review, and sometimes not even publishing the papers. And that would be fall into the category of a fake journal, which solicits papers, solicits the fees, but doesn't publish the paper or send them for peer review. A more worrisome, well, that's worrisome enough, but fake reviews is another worrisome approach, where authors and or editors set up false identities and emails that they can use to invite reviews to their own papers or other papers that are submitted to the journal in order to hide their identity. And this has been detected in a number of cases. And then I mentioned before preprint servers as a threat to peer review. So, and for preprints, papers are posted on these servers and open and freely available for people to read and comment on. In general, this is a controversial area where some people do not allow manuscripts that have been posted on preprint servers to be submitted to their journals. Others do, and there's differences in opinion about that. But most journals do accept papers that have been posted on preprint servers as long as they as long as it's disclosed. And the concern by many is that the articles published on servers do not undergo peer review, and so therefore could be misleading or wrong or dangerous even in the case of clinical trials, which are rarely published on preprint servers, but they could be. But two interesting papers recently came out in 2022 in PLOS Biology that showed that a number of papers they looked at on bioRxiv and medRxiv that were posted on those servers did not undergo substantial changes from the time they were posted as preprints to published in peer-reviewed journals, suggesting that peer review didn't really substantially change the papers from when they were posted to when they were published. So that raises some interesting questions. It could be that the papers are already in great shape when they're posted on preprint servers, and I think in many cases that is true. But it could also mean that the peer review wasn't that effective. Doesn't say anything about the quality of the finally published papers, but I assume they went through peer review. I assume they were pretty good, but that raises another question. So just to conclude, there is room for improvement. Peer review is not perfect, but while there's significant weaknesses and threats, most editors, publishers, institutions, and funders do not consider the process broken and continue to use it. But there is room for improvement, and a couple of things that I think many publishers and journals are trying is to better train authors and reviewers and editors. So to sort of help them in the peer review process. So peer review training, I think, is a useful thing that can improve the overall process. And then whether we can better recognize our reviewers. I mean, we obviously depend on their donation of their time and their expertise. It's asking a lot. There are a couple of ways that can happen. One is there are services like Publons, which is a commercial website that provides a free service for academics to track, verify, and showcase their peer review. And this can be shared with promotions committees, with chairs. And it tries to convert the peer review effort into something that academics can use in their careers. So many journals do submit their names and numbers to Publons, so that's helpful to the reviewers. And then journal recognition, it's not much, but it's the least we can do. So acknowledging the names of reviewers, and you can see a screenshot from a recent acknowledgement from the BJA of reviewers. That may be enough for some, but it's not a whole lot to keep reviewers coming. But it is impressive, the quality and effort of the reviewers that all of our publications really depend on to maintain high quality. So thank you. I'll stop there. And if there are any questions, I will be happy to try to answer them. Thank you very much.
Good afternoon. I am Jean-Francois Pittet. I'm the editor-in-chief of Anesthesia Analgesia, and I will discuss with you during the next few minutes issues about fabrication of data and misconduct. The objective of this short presentation include a real story of scientific misconduct. Then I will discuss definition of scientific misconduct, importance of scientific misconduct. Why does scientific misconduct exist? What can be done to expose it at the journal level? I have nothing to related to this talk. This is a story of misconduct that made a big impression on in television and newspapers. On March 20th, 2020, just 9 days after the World Health Organization declared the pandemic for COVID-19, a manuscript was placed on medRxiv, which described a small non-randomized clinical study that was suggesting a benefit for hydroxychloroquine and azithromycin for treating COVID-19 patients. A journal, the International Journal of Antimicrobial Agents, accepted the manuscript on the same day it appeared on medRxiv, just 1 day after it was submitted to the journal. On the same day, the preprint was posted online and accepted by this journal. The president of the US at the time, Donald Trump, endorsed hydroxychloroquine during a White House press conference. By June 15, 2020, the US government has stockpiled 63 million doses of the drug. US prescription for this drug had spiked to record level in April 2020 as COVID-19 cases were increasing, with most prescription coming from primary care provider. Well, the consequence was that a more sober analysis that was published later showed the conclusion that hydroxychloroquine has no proven role in treating COVID-19 patients. And the last randomized control study was published in the same journal in 2021. So what is the definition of scientific misconduct? Misconduct is defined either by a fabrication of data, making up results and reporting them, falsification of data, which is the manipulation of research material, equipment of processors, or changing or omitting results, such as that the research is not accurately represented in a record. Finally, plagiarism, which is the appropriation of another some idea without giving the proper credit. What are the criteria for scientific misconduct? These are important. They represent a significant departure from accepted practices. It has been committed intentionally or knowingly or recklessly. It can be proven by a preponderance of evidence, but does not require evidence beyond a reasonable doubt, as you see in criminal cases. What is clearly not misconduct is an honest, unintentional error or a difference of opinion. In this next slide, I want to give you some example of fabrication or falsification. For example, creating data for research that was not performed or that differs from the actual result. Splicing together data from different studies to represent the results of a single experiment. Manipulating digital image of data to change or influence the interpretation of the result. For example, changing the brightness or contrast of the image, reusing or relabeling data to represent results of different experiments. Not unimportant, deleting data points or concealing part of the data. And finally, inflating the number of samples that were examined or the number of independent repetitions. The research misconduct is only a part of the scientific impropriety, because you have, in addition to the classical research misconduct, you have human subject violation and animal welfare violation that are also very important. Now, the question we should ask is, are we as anesthesiologists, physician anesthesiologists, are we performing a lot of misconduct? Well, the retraction watch leaderboard, which collects the number of retraction by physician and researcher, show that the first three physicians, Dr. Fuji, Bolt, and Ushima, that they have the highest number of paper retraction are all anesthesiologists, suggesting that it is not without importance that misconduct happens in our specialty. The question is, do we see more retraction in health science during the last 20 years? And a recent paper published in European Art Journal shows that, as you can see, a progressive increase in number of retraction. What is, however, important that only 4 papers of 10,000 published articles are retracted. And we should say that retraction are not always performed because of author scientific misconduct. There's been sometimes the concept of retraction and republication if an honest error was made that really affect the result. What are the reasons for article retraction in anesthesiology? This is a paper published in the Canadian Journal of Anesthesiology in 2020. And what is interesting, it shows that 50% of the retraction were due to data manipulation or fabrication fraud. But you have around 30% of the retraction, almost 30%, that were issued with ethical approval. The study were performed without a formal ethical approval by the IRB. The rest of the reasons are much less important, in particular the plagiarism that only corresponds to 6%. This next slide shows an interesting relationship between true scientific productivity versus emphasis on research quality and quantity. On the left side, you see that if you have a process that overemphasizes quality, that might require multiple blinded study, mandatory replication of result by independent party, this would produce a very few results due overcaution and would hinder productivity. On the other side, on the right side, an overemphasis of quantity is also problematic because accepting less scientific rigor in statistic replication, quality control, or less rigorous review process would produce a very high number of articles, but after you considering costly setbacks that are shown here, associated with high error rate, true progress would be also low. So finally, I think we see that we have an optimal position between quality emphasis and quantity emphasis. I have to say that the authors that I mentioned before that have high number of retraction are in this category on the right side, where they publish multiple papers for multiple years. The next slide shows you the replication and generalization test over time. If you make a discovery here on the bottom of the slide, you have in dark blue the commitment to replicability and the possible generalization of the result. If you continue to study what you have observed and you continue to have success, what you see over time here is that you have a better replicability, but the results are not as generalized because they are limited by multiple factors. In contrast, if you see a persistent failure to replicate the data, not only you see a decrease in the commitment of replicability, but you see also that the generalization of the data is disappearing. So this interesting slide shows you that the replicability of the data is critical. Now, I want just to mention that detrimental research practice may conduct to misconduct. Indeed, if you start to take shortcut, you cheating by inflating your resume, you beautify the image that you publish. These are a small step that slowly conduct to scientific misconduct. Now you will have lack of appropriate controls. You may manipulate the image. You may forget the outliers. This is an important issue because people sometimes have tendency to eliminate the outliers. Why? Because outliers will require to have a larger sample size to demonstrate the effect. And finally, you go to classical image manipulation that is misconduct. The question now is, what is the rationale for performing scientific misconduct at the faculty level? I think the most important are certainly character issue and failed morals. I think some people are willing to do this and do this consciously. There are other reasons. The concept of publish or perish pressure, the need to publish to keep your tenure, retaining a job, keep your laboratory, I think are very important. And if your studies are not going the way you want, I think is a risk that someone will start to perform misconduct. Also the desire to get ahead. And finally, a role of predatory journal. I do believe that the journal unfortunately play an important role here. The next slide shows you that at the fellow staff level, the reasons are slightly different. Certainly competitive pressure in order maybe to get a faculty position. You need to have published a certain number of papers, good papers to get this faculty position. A pressure to make a good paper. You're not happy with your result and you have take the risk to, to manipulate the data. Some also personal psychology, be terrified of failing. Therefore, you push to fabricated data. Poor supervision of the PI that doesn't look at carefully what the staff and fellow are doing. And finally, important, inadequate training. Your staff or fellow are not sure how to perform properly the research that you ask them to perform. The next slide discusses if submitting to and publishing in predatory journal is a covered form of research misconduct. My answer is yes. Predatory journal is what is defined, and one journal that's masquerading a genuine academic publication, but offer little, if any, rigorous peer review, as I showed before early in this talk. Predatory journal or publisher place a focus on financial profit as opposed to regulated dissemination of scientific advancement. Authors can often get their work published in such journal with very little scrutiny on quality. And finally, not unimportant, also generally warned against and discouraged, university practice sanction against researcher submission to and publication in predatory journal is really not common. So what we be doing at the journal level to prevent and expose scientific misconduct? These are few steps that we are doing, but it's good to repeat this. Reputable journal have a very strong peer review process that needs to be defended today. Reputable journal should have a good editorial board. Reputable journal should follow recognized publishing standard. A reputable journal should be transparent about the fee if it's an open access journal. And finally, the reputable journal should be indexed at Medline or Web of Science. I would like to show also why the reproducibility is so important. This is a very interesting article published by Michael Aviden and George Mashur in 2019 in the British Journal of Anesthesia. Basically, they address the question of reproducibility, and they show that there are three pillars. First, methodological approach. They are well defined that allow other researchers to reproduce the study. Very good analysis of the presentation of the result. And finally, what they are really more concerned is the discussion part of the paper with an interpretation and discussion of findings that are really critical. In that paper, they discuss the level, at the level of the manuscript, as I said, promotion of replication of method and result. But they are very concerned that many discussion sections of the papers that we published have deficiency, lack of contextualization, over-interpretation of the result, insufficient acknowledgement of limitations of the study. And they suggest, perhaps, should we eliminate the discussion section of the manuscript? There's a question mark. What they are proposing, which is interesting, is to add at least a second discussion written by an independent author with appropriate expertise in research methodology used in the original manuscript. I think it may be a little complicated to do it. On the other side, I think it's a very interesting approach to place the result of the papers in the right context. Of course, editorial and post-publication review and comment are of importance. Finally, in conclusion, I do believe that the basic principle in conducting research is that research should pursue the whole truth and nothing but the truth. However, as editor of a journal, I do believe that researchers are innocent until they are proven guilty, not the contrary. Thank you very much.
Good afternoon. My name is Cynthia Wong, and I have the honor of giving the last lecture in this panel entitled Clinical Anesthesiology Faculty Pressure to Publish for Promotion. I have no financial relationships with commercial interests to disclose, and my presentation does not include discussion of off-label drugs or investigational devices. I have been a member of 2 medical school promotions committee, and I am currently a department chair and responsible for the promotion of my faculty. And so I hope this helps me have some insight into the topic at hand today. So at the end of the lecture, I would like you to be able to describe concerns regarding current academic promotion criteria for clinical faculty and articulate good publishing practices for academic scholarship. So we can start out by saying, why do we care about this? Well, one reason to care about it is because most of us are clinical anesthesiology faculty. This was a study that was published a couple of years ago using AAMC data, and the authors asked about, number one, the growth of clinical departments in the faculty numbers and what was growing. And as you can see here, between 2006 and 2016, our departments grew in size by about 50%. But importantly, all of this growth was in non-tenure track faculty. So the tenure track faculty grew very little, and the non-tenure track faculty grew by almost 70%. And this reflects other medical specialties too, where again, the number of faculty members in tenure track positions really did not change over the decade, but there are a lot more clinicians among our faculty ranks. So why is this important? Well, promotion criteria, traditional promotion criteria were developed in universities and not necessarily medical schools. And they are based upon the activities of tenure track faculty. And so when we add clinical faculty to the mix, we confuse things because they do different things than traditional tenure track faculty in non-healthcare clinical departments. There have been a lot of voices expressing concern about this recently. The authors of the article that I just mentioned brought up the lack of alignment between promotion policies between tenure and non-tenure track faculty. They pointed out that there's little consensus on the need for scholarship among clinical faculty, and indeed the definition of scholarship is not clear. and that promotion systems may value scholarship over contributions to other missions. And we know that academic departments have other missions beside research. Obviously, one of them is clinical care. Education is another big one. Administration is another one. And traditional promotion criteria often do not take these other missions into account. Another group of people actually looked at the traditional promotion criteria for scientists. So these are people in the tenure track and expressed concern about these criteria as they currently exist. They promote some bad research practices, including publishing lots of papers that may be of low quality. Dr. Pittet talked about fraud in the medical literature, and again, sometimes these promotion criteria may promote fraud. And so this group of academicians suggested 6 key principles for assessing scientists for promotion. And I think these actually also apply to clinicians. One was that the work that is being done, whether it is research work or other work, should address societal needs. This is an important goal of our scholarship, and there's no point in doing it if we don't make our world better. They said that the indicators should fully reflect contribution to the scientific enterprise. For example, it's not just the first and last authors that contribute to the scientific study, but many of the middle authors also have important contributions. The system should reward complete and transparent publishing of positive and negative results. Our current system rewards positive results, for example. We should reward a culture of open research, and our current system often promotes secrecy. We need to fund research that actually looks at how our incentive systems, and promotion is one of them, compensation is another, help to achieve the goals that we want to achieve. And currently, again, we are relying on outdated systems that are likely not contributing to the goals that we want to facilitate. And finally, they suggested that we need to fund with our research funding out-of-box ideas. So I'm not going to get into the tenure versus non-tenure question. That would be a huge, long debate. But I would suggest that it makes for an artificial divide that makes our job harder. So each of us in a clinical department have a role, and that role may concentrate on clinical care and education, or it may concentrate on research. And as long as we achieve that role and push our goals forward for both the department and the institution and society as a whole, we ought to reward the individuals with promotion. I'm not sure why some individuals should be awarded with tenure and others not. It doesn't make sense to me. Again, a whole big discussion, but it does provide this artificial divide that complicates our job. This is a study of promotion criteria that was done in research universities around the world. And what the authors did is looked at promotion criteria and attempted to ascertain whether they contained what they called traditional criteria or non-traditional criteria. The traditional criteria you could name probably without me going through them: a minimum publication number threshold, a preferred author order, the preference for publishing in a high impact journal, grant funding, national and international recognition. The non-traditional criteria included looking at citation thresholds rather than publication number, and then other aspects of good research that currently we do not do a very good job of evaluating or assessing. And they include data sharing, which includes open access publishing, trial registration, adherence to reporting guidelines, alternative sharing methods, if again our job is to share what we know. Journal publishing may not be the only way to share that knowledge, and accommodations for employment leave. And what they found is that most of our research universities are still relying on traditional criteria. Those are the orange bars right here. Non-traditional criteria play less of a role. And if you look at the non-traditional criteria, only 2 of them really played a role at all. One was that some promotion criteria do assess citation thresholds, and most of them, or at least some of them, mention accommodations for employment leave. None of these other non-traditional criteria in the middle here, data sharing, trial registration, adherence to reporting guidelines, are being assessed in our university's criteria for promotion. Something to think about. Now, again, most of these criteria, traditional criteria, were developed for your traditional tenure track scientist. In the last couple of decades, I think all medical schools have recognized that many of us are not traditional scientists, and there need to be other criteria for evaluating our contributions to the, again, department and institution. This is a list that was put together by an internal medicine group a couple of decades ago, and I think criteria along these lines have been incorporated into a large number of our medical schools' promotion criteria for clinical faculty. This all constitutes scholarship in the minds of these individuals. What I highlighted in yellow are activities that require some sort of written documentation. And I actually think this is important. So what we're doing needs to be promulgated. Other people need to hear about it. Whatever that activity is, right? If we are not doing that, then we really are not doing our job in an academic department. I think the easiest way to do that is the written record, but there are certainly other ways of showing that one has contributed to new knowledge or educating others, including virtual lectures and other ways of disseminating information. All of these things have in common that they are looking at multidimensional aspects of our job, not just productivity, which traditionally has been measured with the number of papers that one publishes, but the quality of the work, the reproducibility of the work doesn't really help if we publish a paper that can't be replicated. Sharing of our information so that others can make use of it too, and then obviously the translation potential of whatever we're doing. Is this helping society become a better place to live? Unfortunately, most of our traditional promotion criteria are quantity-based. It's the easy thing to do. You can count. It's pretty black and white. But as we have said, it tends to promote some bad behavior, research behavior and otherwise. And so our job is to figure out how we can better measure quality. That's not the easiest thing to do, or we probably would have done it already. As I said before, some promotion committee look at the quality of the journal that the research is published in, and they measure that quality with the journal impact factor. Again, this could be a whole lecture. Journal impact factor is certainly an imperfect measure of journal quality, and it's less of a perfect measure of specific article quality in the journal. That being said, there's still a lot of our research universities, that's our type here, that use impact factor in their promotion criteria. This was a survey of United States and Canadian research universities. Fully 40% in 2019 used the journal impact factor as one of their criteria in assessing the quality of the material that people were including for promotion. So that doesn't seem to make much sense. We talked about ability of others to access our research as a measure of quality, and some have suggested that research be published in open access journals. This is obviously, again, a very complicated question, and it's certainly not black and white. Many open access journals are predatory, and we certainly don't want to encourage our clinical faculty to be publishing predatory journals. This is just a short list that was published in the dermatology literature about attributes of reputable open access journals. Again, I think the publication in an open access journal at the current time cannot be used as a black and white measure of quality. More interesting to talk about are article level metrics, including the number of citations. This is measured by a couple of different ways. One is the H-index. It's probably the most well-known. The problem with the H-index is it's very dependent upon how long somebody has been publishing. The longer your paper has been out there, the more citations it's going to get. One way to control for this is the M-index, which divides the H-index by the number of years that the individual has been publishing. Another metric is to look at downloads. So this is an interesting one. When I was the section editor for OB anesthesiology for an AUA a number of years ago, we used to look at both the citations and the downloads for articles in our section as a measure of how well were we doing, right? How relevant were we? And it was interesting to me that we in the OB section were not high in the citation list, but we were the highest in the download list. And to me, that told me that probably clinicians found our articles very useful, and they were downloading them on a regular basis. Your average practicing private practice clinician is not writing research articles or review articles and writing citations, but they do download articles and make use of them in their clinical practice. So again, more than one way of measuring quality and impact on clinical practice, and these should probably be taken into account in our promotion criteria. Other ways of looking at quality include trial registration. We all know that all journals now require randomized controlled trials to be registered beforehand, but this is not necessarily true for observational studies, systematic reviews, or other biomedical science studies. It's much easier to do shoddy research if you don't tell people how you're going to do it ahead of time. You can change the primary outcome, you can change the number of people enrolled or the number of cases that you're reviewing. And so trial registration is sort of a check on quality of publication. Adherence to research and reporting guidelines is another measure of quality. There are even case reporting guidelines out there. You would think that there would be pretty simple to publish a case report, but there are a lot of pretty poorly published case reports out there. Adhering to the guidelines is a measure of quality. And then I think the most important one is, does the research benefit patients, physicians, and the community at large, right? If we're doing something that doesn't benefit our community, then it's probably not worth doing. And again, I noted before that all of these were developed as multidimensional incentive buckets for our traditional research faculty. I think they fit equally well for our clinical faculty. So what do you, as a clinical anesthesiologist who wants to be promoted in an academic department, do? Well, we said it's a little messy, unfortunately. Promotion guidelines are not straightforward, and they're subject to a lot of interpretation by the promotion committee. But I actually think that doing the right thing is pretty black and white. What's the right thing? I think the right thing is to pick scholarship about which you are passionate, whatever your area of focus is. You should pick scholarship that someone else cares about too, because if no one else cares about it, then it's really not going to move us forward. Supposedly about 45% of the current, what's currently published in the traditional academic journals is never cited in the first 5 years. To me, that means it's pretty worthless. No one cares about it, and it's a waste of time, and we should be doing something that really contributes to changing our society. I think if possible, we should figure out how to report it. And again, this might be in traditional medical journals, but there are other ways of reporting it. We work in academic institutions. Part of our goal is to move us forward, and we need to tell people how we're doing that. Even if you're the leader of a new clinical service, for example, then I think we need to figure out a way of reporting that so other people learn from it. The ANA practice is an excellent example of a journal that supports that kind of thing. There are lots of other journals like that out there now too. And then finally, I think you need to pick a publication mode that serves to disseminate your work, whatever that might be. And that's really where the high impact is. It's not in the particular journal that you publish it in, but it is in the mode of publication that gets your message out there and actually changes our world for the better. So I think we're in a transition period in terms of promotion. That's sometimes very confusing, but I think it's actually pretty straightforward if we do the right thing. That may sound very idealistic to you, but I do think that promotion committees in medical schools recognize what the right thing is, particularly if you tell them what you're doing and why it's important. Thanks very much for listening. I look forward to our panel discussion. This last slide is just to celebrate the fact that both the Iowa men's and women's basketball teams won the Big Ten within the last 2 weeks. So again, thank you very much for your attention, and I look forward to speaking with you during the panel discussion.
Well, first off, I want to thank everybody for their patience and forbearance with a little bit of a bumpy start, the climb out, as they say. The pilot tells us there's going to be a little bit of a bumpy climb out. I also want to give a shout out to Evan for his great impersonation of Darth Vader. Who knew that he had that hidden skill? Maybe he was actually inside that mask instead of James Earl Jones. I want to ask everyone if they'd be kind enough, if you have questions, to go ahead and put them in the chat session, because it's going to be a little challenging for me to bounce back and forth between these two simultaneous platforms. While we're waiting for some questions to come in, I wanted to get your thoughts, Hugh, and then have a follow-on from you, Cynthia, on thoughts about, in terms of opportunities, thoughts about increasing diversity, equity, and inclusion in our journal peer review database or databases and our processes. I know that you've been very instrumental in that regard, Hugh, and I know, Cynthia, you have some thoughts about that. I'd like for us to be able to hear all about that.
Thank you for the question. I think we can do better. One of the issues we have is collecting information on diversity, both gender, race, ethnicity, in a secure way, and people being comfortable sharing that information. Currently, we don't collect that in the BJA. So the only thing we can do is go by first name, which has about a 90% accuracy. It's better than nothing, but that's kind of where we are. Some journals are starting to collect information, and we're working with our publisher to try to join that group, but we're not there yet.
Cynthia, follow-on thoughts?
Yeah, just that we have to be extremely intentional about this. So, I started out my career, I think, at a very good time. The medical school classes were increasingly a higher percentage of women. They've been close to 50% for almost 2 decades now. And early on, people said, well, you just have to wait a bit, right? Because people have to climb through the system and they have to be an associate professor or so before they turn into a reviewer or an editor. Well, we've waited 20 years and it hasn't happened. So we got to do better. And I think that means being intentional. It starts early on in mentoring people how to be, we got to be a researcher first, right? Or somebody who wants to publish, but then mentoring people to be reviewers, to be editors, and then being totally open and intentional about who we pick to be our editors, for example. Publishing the position, making sure that we let people know about it. Historically, editorial positions have been just turned over in the family. People knew people and they said, well, you're in my department and you do a good job, so why don't you be a journal editor? And that results in picking people that look like you. And so we have to get redo those processes, revise those processes, I think, and intentionally recruit diversity. Listening to the peer review process, as Dr. Hemmings talked about it, everybody does better if you get different ideas in there, right? That's not just the peer review process, but everything in life, our departments, the boards of industry, that kind of thing. So we've got a ways to go, but I think we're thinking about this now. And I think journals are thinking about it. All of our journals are thinking about it. So I'm cautiously optimistic, but it's an intentional process.
Excellent. Well, I appreciate your thoughts, as always, Cynthia. There's a question posed to you, Evan. But while you're taking that one, I wanted to get your thoughts about the role of contributors, legitimizing contributors versus authors, and how to handle work groups that are involved in the background of developing, for instance, practice guidelines. And the ASA does this all the time with committee work, for instance. But I want to give the audience an opportunity to have their questions posed. So a question to you was, do you think that authorship should be normalized within reason to the seniority of the contributor? Do you require more understanding from senior authors than extremely junior ones? So some of that speaks to how do you determine the order, right, of authorship?
Yeah, those are good questions. Hi, Phil. I guess if we look at our authorship criteria, sort of two-dimensionally, or the criteria of any journal, or the criteria of any of the cognizant organizations, ICMJE, World Association of Medical Editors, Council of Science Editors. They are normalized, if you will, not normalized, if you will, across the board. There's no points added or subtracted, if you will, for the age or experience of the author. Now, having said that, I think the expectation is normalized, and that is, I think we do have higher expectations of those who should know better and who know more. And that's really the role of mentors and mentorship and lab directors in terms of educating and determining authorship. We know from experience that very often in collaborations, authorship is the very last thing that is ever discussed. A manuscript without a cover page gets sent around to a bunch of individuals, and you may not even know if you're being considered as an author or not. So I think I encourage everybody to very upfront at the beginning of a collaboration, establish the expectations for authorship and make sure that everybody is in agreement with those. It will save a lot of coronary artery spasm at the end of the process, and a lot of stomach acid. Now, trainees aren't going to know those norms. I encourage them to do reading about this. There's a lot of tribal wisdom, a lot of laboratory practice. Very often, the lab director determines who's an author, and trainees are in a vulnerable position. And so again, I think it's really important that there be laboratory standards and institutional standards, as well as domain or field standards. I learned many years ago when I was a university vice president that the criteria for authorship in the world of particle physics is completely different than the criteria for authorship in biomedical science. And as an institutional official, I had to come up with an authorship policy that could meet the needs of all of those disciplines. But we were able to identify fundamental aspects of criteria for authorship.
So Evan, I just want to jump in because I know we may get shut off, but there's a question here which I think ties in nicely to what you're just touching on. It's an anonymous post, which we understand because of vulnerability. How do junior authors navigate situations in which they feel pressured into granting gift authorship? So this individual picked up very quickly on your terminology, gift authorship to more senior individuals, especially if there might be professional repercussions for refusing to comply. I think that's a very, very insightful question, a hot button issue. Yeah,
it's an extremely important issue, and that really speaks to the issue of vulnerability. If it's coming from outside the lab, it's pertinent to discuss with the PI. If it's coming from inside the lab, every institution has research integrity officers now, and you can make a phone call. You can do this anonymously, but that is an institutional resource to take and register that as an issue. And I would encourage people to do it because I very well understand the vulnerability of trainees and junior faculty in this.
Excellent. And Cynthia, one of the things I wanted to ask you about in your role as a department chair, you're very well, and Hugh and everybody, I'm just specific to you, Cynthia, about the challenges that anesthesiology may face versus some surgery colleagues, because it appears that surgery journals, and I'm taking a risk here, have a little more liberal perspective on authorship. And it's not uncommon that you'll see someone going up for promotion after 4 or 5 years in surgery, and they have 50 publications, whereas their anesthesiology counterpart, contemporary, may have 10, and everyone kind of scratches their head. Any thoughts about that, or has that been your experience that sometimes you've encountered that?
Well, Yeah, it's certainly different among specialties, right?
Right.
And it's not just surgery, but it's medicine and all other specialties. That's why promotion committees have representatives from different specialties on them. And I think it is part of the responsibility of the individuals on the promotions committee from different types of departments to recognize that there are differences among specialties. Just as Dr. Kharasch said, there are differences among journals of different specialties. It's absolutely true among promotion activities within our specialties.
And that's why I appreciated your emphasis on the quadpartite mission, which
I
is
would
something-
like to apologize. I couldn't sign on the camera. It was, you know, Ivan, your voice was off and I couldn't. And finally, I'm here. I apologize. It's not that I tried to run away.
No, we're glad to have you,
I just want to
Jean-Francois.
make one comment at the beginning because I was able to hear a part of the beginning. We have, as a journal, we have now a DEI editor. And I feel that is Paloma Toledo. I feel that is very important to have such an editor that is not a section editor managing articles like other section editor. Our job is really to develop the role of minorities in this journal. I think Cynthia wrote an editorial that was clear about the, you know, it was either salary I forgot or promotion of women, you know, as full professor in our one article that we published. And I feel that it was very critical for us to have someone that can develop, think about what can be done, because it's easy to say that there is a problem. The question, the solution are not as simple. And one example, and I will stop, is that in Europe, for example, in Germany, you can work part-time. Dr. Zarborg, his chair in Münster, is one of our editors. He said to me many times that in his department, most of the people are working not full-time, 80%, 70%. In America, it's difficult. And for women, particularly when they have children, I think it would be a great opportunity if we could work less. And it doesn't prevent in Europe women to become to move on in a career. So I think we need to think out of the box here, but I'm stopping. Thank you.
Very good. Thank you, Jean-Francois. I'm going to get to Mike Crowder's question in a minute, but that's going to take us in a completely different direction. Hugh, I wanted to get your thoughts. You touched just a little bit about you really did a nice deep dive on single blinding, double blinding. I grew up in the Steve Schaefer era and came up through the masthead, and Steve for ANA, and Steve really encouraged everybody to sign their peer reviews because he felt that it promoted civility. And I'm wondering if you think that that's realistic, or is that putting some folks at risk if they are more junior and be concerned that they're signing a review that might come back to haunt them? I'm just curious about your thoughts about that. Does that really enhance civility?
Well, I think it does, but I think I have the same concern that you have about junior reviewers, potentially eliciting some backlash if they don't have the same academic standing of you and Steve Schaefer. But people are free to sign their name. So, and I just wanted to let Jean-Francois know that if he wants to come work here at 80%, I'm happy to grant you 80%.
You're very sweet. It's not you guys. I think it's the organization that don't make easy. I think to get part-time, and I feel I'm not saying it is the solution. Is one solution potentially to help people to balance. We never talk about so much about wellness when wellness doesn't exist. It's a human reaction. You talk about a lot of stuff when they don't exist. And I think in our profession is very difficult. So I think if maybe a little more time for yourself, what is outside your profession may be important.
Well, I'm going to have moderator's prerogative and ask one more question, and then I'm going to get to Mike's comment. What are your thoughts, Jean-Francois, Hugh, and Evan, in your roles as editors-in-chief of 3 major anesthesia journals, of compiling a do-not-fly list of authors whose papers have been retracted for outright data fabrication or gross misconduct? Any thoughts about that? I'm sure you have thoughts. It's just whether or not you're willing to share them. I'm going to go around the Hollywood squares and pick on you first, Evan.
We have discussed this amongst some of the editors before. I and anesthesiology have zero tolerance for research misconduct. I think that a couple things. First of all, as regards papers that have been retracted for misconduct, many of these are still zombies, and they are cited for years and years and years after they're retracted. So I think one thing is that journals, either they need to keep a list of retracted papers or they need to consult databases of retracted papers when articles are evaluated to make sure that manuscripts don't cite retracted papers. So I think that in a sense, those no-fly lists already exist, and I think we need to use them in our peer review process to ensure that retracted papers don't get cited in manuscripts. As far as authors, I think we have to be careful in terms of those people who your journal finds to have done something which you found to be less than acceptable versus individuals who have had formal misconduct evaluations and citations. Because I think it's important that we do due diligence and due process on individuals. It's one thing to have a particular encounter, but most journals are not in the business and don't have the resource to be doing scholarly misconduct investigations. That's the purview of universities. If we have suspicions, it's appropriate for us to refer them to the university. And if a university has been found that an individual did commit scientific misconduct, I think it's eminently reasonable that we track that, but not operate on one-offs, suspicions, and unverified accusations.
Okay, Hugh, thoughts?
We have a list of problematic authors, and you know, we use it. If there's doubt about a paper and they show up on our list, that's sort of a that can cause us to decide to reject rather than offer revision. You know, it's not that it's not going to get published somewhere, but the kind of things, the things that get you on that list are duplicate submissions and things like that, which don't really require adjudication. And you know, that's happened a few times. So.
Okay.
Yeah. And let me put a fine point on this, Tom. We do the same thing. We have our own internal list, if you will. I think your question had to do with, do we publicize that list, if you will?
Right.
And so we
or circulate it, I guess.
Circulate it, I should say, not publicize it, but circulate it. We
don't do that. Yeah.
Yeah, we don't circulate our list. We have one, but we don't circulate it.
And mon ami Jean-Francois?
Well, I think I want to bring an interesting issue that I had a co-author that was at the time a resident of our dear friend Bolt. They came to me and they said, you retracted the paper because Bolt has his name as a co-author. He was not the first, he was not the last, he was not the corresponding author. Probably, as Evan said, a gift authorship. And he tried to tell us that that paper was not fabricated. And it was 20 years ago. So you can imagine the university in Germany said, you have to retract every Bolt paper, period. End of the story, we cannot verify. On the other side, I have two guys coming and saying, we did a study, we know that. At the end, I made the decision not to change my retraction because he would have forced to republish the paper and they couldn't show the original data. Obviously, it was over 20 years ago. But this is one issue that I think we need to think about what we can do with younger authors. Maybe they're complice, but they may not necessarily be also committing misconduct.
Yeah, for sure.
That is one issue that I think we need to. And the other issue, I had recently a paper that we published in our journal, and another editor, not you guys, but another editor-in-chief contacted me and said, I have a paper from this colleague that I think misconduct. Well, we did what you do. We got the original data. We verified everything we could. We couldn't prove misconduct. So we decided not to close the file because you cannot, as I said in my little talk, the people are not guilty before proven innocent, but they are innocent.
Okay. Well, we have a few minutes left because Dr. Hemmings needs to pivot, and I want to just get now to Mike's comment. But I want to preface it by really acknowledging Cynthia's thoughtful observations about this expanded definition of research about contributing to generalized knowledge. You know, I grew up with that being the conventional definition, and looking at broader ways, a broader definition, and more innovative formats and venues. But you touched on something about downloads, you know, and versus citations, downloads being a great additional metric. And as you very well know, it's a key metric that we use in our journals. So Mike has been very patient if he's still on, and he would like us to talk about the pressure of journals to increase their impact factor. That's a large, broad landscape, but is this something that editors-in-chief are judged, and can this negatively affect the quality of science published, which should be our primary goal of the best journals? And this goes to, you know, papers that, to your point, Cynthia, that don't get cited and don't get downloaded. You know, that's not very good use of our very finite, constrained resources. So, you know, with the content expertise on this call, I'd love to start a conversation. I'm not sure where it's going to go, about the importance of impact factor versus the other things that play into your calculus. And I'm going to start with you, Hugh, because I know you need to segue and pivot to something in a few minutes, but I'd like to get your thoughts on this first.
Well, unfortunately, it is important. I mean, people don't really admit it, but that's, you know, if people love to have one number they can judge things by, and that tends to be the one in publishing. And, you know, I think it does have a negative impact overall. You know, there are ways to game the impact factor, and journals do that. My feeling is that you need to do the right thing. We publish plenty of things that I am fairly sure are not going to get cited. And, you know, that's not the only criterion. Obviously, we love to get things that are well cited. I mean, sometimes it does mean that it's an important thing. And, you know, that's the best of both worlds. But, you know, I think there's been a proliferation recently of publishing guidelines to the point where we're publishing guidelines about guidelines, and, you know, it's really kind of out of control. But those are easy ways to generate citations, and we saw that with COVID-19. And I think there's going to be a big blip in impact factor from that on many journals, especially anesthesia journals, where there was a lot of stuff. So anyway, I'll leave it at that. I mean, I wish it weren't important. Let me say that.
Yeah. So, Evan, thoughts? Either broadly based or drill down on something.
It's funny because Eugene Garfield was the person who created the impact factor. I've been reading Eugene Garfield's work since the mid-70s. I don't think Eugene Garfield developed the impact factor to be used for what it is used today. I believe that it has been completely warped in its usage. I think the impact factor has had a supremely negative effect on scholarly publishing. I said earlier that not only do individuals have ethical responsibilities and institutions have ethical responsibilities, I think journals have ethical responsibilities as well. The impact factor has caused journals to do some very strange things. It clearly has influenced behavior. It has caused journal misconduct. The impact factor can be easily gamed. Any editor that doesn't know how to game the impact factor shouldn't be an editor. It doesn't mean that they should do it, but the impact factor is so easy to game and so easy to manipulate. And I think it's tragic if it is misused in ways that it was not intended to be. Suffice it to say that you know, to be a little bit tongue-in-cheek, those who worship in the temple of the impact factor revere a false god. I think that it's important for journals to have impact, but I don't think that impact factor is either the most important or the singular way in which to evaluate that.
Well, I agree. And the better half is a medical librarian, and she taught me that gentleman created the impact factor to prioritize shelf space in a conventional medical library as to what journals he should buy or subscribe to put on brick and mortar shelves, which is obviously a long ago phenomenon. So Jean-Francois, of course, my friend, I want to get your perspective on the impact factor being the holy grail. We've always discussed among us, as Evan just suggested, it's not the impact factor per se, it's the impact.
I agree with what Evan just said. I think we should have tried to have impact and not, and let the impact factor go the way it goes. Unfortunately, we know there's been manipulation and serious manipulation among some of the journals. So I think it's a problem. But I think it was mentioned also before during the talk that download are important. I think maybe it was you, Cynthia, I'm not sure.
Yeah, Cynthia really hit that.
Download is very important because our journal is a clinical journal, much more than for example, anesthesiology. And the clinician, they may be interested with some of our articles and they will download it. They may not cite it. But I think the download is important because this is the impact that we have on a specialty. On top of it, I think is important financially because the publisher is interested with download as much more than impact factor actually.
So I want to come back.
We need to put this together and find new criteria. You mentioned some of them.
Yeah.
Analyze the quality of the publication.
Kind of find a better equipoise. So Cynthia, I want to come back to you because you did hit the nail on the head with regards for promotion criteria to look at how often is a paper downloaded. And my question I had written for you, I wrote, Cynthia, what advice do you have to educate APT committees and the provost about the added value that clinician researchers, clinician educators, vis-a-vis also downloads, all that? How do you package that in a way that enlightens them, I guess? I'm just curious because
this is a tough one. And part of the problem is that all of our medical schools are part of larger universities, right? Research universities. And so they don't have clinician anesthesiologists or clinician anything in the School of Liberal Arts. And so it has to be a system that works for everybody, which makes it much more complicated. There's a couple of things. I also, as a similar to, I'm sure everybody on this panel, write a lot of letters of recommendation for people who want promotion for other universities. And so you get to look at a lot of the promotion criteria. One is, for example, that the individual going up for promotion has to list their top 5 or top 10 papers and explain what kind of impact they have. I think that's a good way of doing it, or one way of doing it, because then you can literally tell them why this paper is important, and you can put your own statistics in. What were the downloads? What were how were you measuring impact? And why do you know that it high impact? But I do think it is a combination of perhaps actually changing the criteria. It is a combination of the individual doing a better job of explaining to both the promotion committee and the people writing the letters what the impact is, because you can't just look at the title and see it. And so I think we have to attack this from a number of different routes. As I said, I think it's in transition right now.
Work in progress.
Yeah, work in progress. Thank you.
Sure. I'm just checking to see. I'm just going to sneak over to the other side to see if I have any other things that I've missed. I know Richard Prelip had asked early on about whether departments should essentially prohibit faculty from publishing work in predatory journals, especially obviously if there's financing involved. And I want to make the key distinction between what we've defined here as a predatory journal versus an open access journal. For instance, the effort that Hugh and his colleagues are making with BJA Open, which is very innovative and I think will be kind of a trendsetter. That's one point that was raised about should departments be a little more in an oversight role in allowing their faculty to participate in predatory journal in that swamp that's been created. I want to come back. Sorry, I'm going to come back to my Zoom. Hugh, you sit in the unique position of having both hats as an editor-in-chief and a department chair. What are your thoughts? I mean, about trying to provide at least pretty clear guidance to your faculty about proceeding down that dark rabbit hole of predatory journals. I mean, do you all have an open dialogue about that at Cornell?
Oh, yeah. I mean, we've had a few near misses where people get sucked into this, like,
it's
oh,
a vortex, it's a black hole.
Yeah. And I go, no, you don't want to do that. But it takes education. I think, there are new people joining the department every year. So it's an ongoing issue. I think there's more awareness now that, when it first kind of flourished, the initial burst of, or the surge of predatory journals, I think a lot of people got misled. We had somebody submit a paper and then they realized it was predatory and they tried to withdraw it and they couldn't withdraw it. It's a very complicated quagmire you can get into.
Very good. Well, I have some other questions, but I want to be respectful of everybody's time because it's 6:15 on the East Coast. And so I am open for any last comments from this phenomenal symposium panel. I can't thank you all enough on behalf of Jean-Francois, who was the official organizer, but I felt a little bit like a kid in the candy shop being able to moderate this. So anyway, any parting comments? I'm going to start with you, Cynthia. We'll go around the Hollywood squares.
I have just a final comment, is that as Cynthia discussed really well the promotion plan for clinician. I think one of the issue is anesthesiologists are doing way more clinical work than many other specialty. And I think that if it's depending, if you take, for example, the University of California, they have the whole system, they have different category and they do not expect that you publish a lot if you're a clinician. In contrast, is UAB publication are requested. And it seems to me that this should be potentially addressed in a better way to give more chance to clinicians to
Sure. Yeah, agreed. Cynthia, as a department chair.
Yeah, no, I agree with what Jean-Francois just said, that we need to figure out better ways to reward academicians of all types for the work that they're doing. And we have some work to do in that regard, right? Which is why I was asked to give the talk in the first place. Our award system is not necessarily aligned with our goals.
Good, excellent. Evan, I'm going to let you take us home, as they say.
Tom, thank you very much, and my thanks to Jean-Francois and Cynthia and Hugh, who had to leave. This has been a spectacular discussion. I hope that people who are listening will come away with a couple of thoughts. One is, across the spectrum of journal editors, I think you'll appreciate that there's far more that unites us than divides us.
Sure.
We all have, I think, some very common goals. I'll speak for anesthesiology, and that is, we want to do what we put on the cover, and that's trusted evidence. And our goal is really to help authors as much as possible improve what they do and the way in which they communicate it. So in turn, we can educate the specialty.
Excellent. Well, with that, I think I'm going to bid us all adieu, and perhaps a bientôt. And my French accent isn't what it used to be, but I haven't been to France in a long time, but maybe I'll get back there again. So anyway, everybody take care, be safe, stay well.